Welcome to the Mr. Hospital Doctor channel. Today, we'll be focusing on a crucial topic in healthcare: cancer. Cancer stands as one of the greatest health challenges humanity faces. However, armed with knowledge and awareness, we can overcome this disease. In this video, we'll explore what cancer is, its symptoms, and treatment options. Let's embark on this journey to understand the importance of health together. What is cancer? Cancer is a complex group of diseases characterized by the uncontrolled growth and spread of abnormal cells in the body. These abnormal cells can form tumors, impair normal bodily functions, and interfere with the body's immune system. Cancer can affect virtually any part of the body and can be life-threatening if not diagnosed and treated early. How does cancer develop? Cancer develops when normal cells undergo genetic mutations that cause them to grow uncontrollably and evade the body's mechanisms for regulating cell growth and division. These mutations can be triggered by various factors, including genetic predisposition, exposure to carcinogens, such as tobacco smoke, ultraviolet radiation, or certain chemicals, unhealthy lifestyle choices, such as poor diet, lack of exercise, and excessive alcohol consumption, and infections, such as certain viruses and bacteria. As these abnormal cells multiply, they can form a mass of tissue called a tumor. Tumors can be benign, non-cancerous, or malignant, cancerous. Benign tumors do not spread to other parts of the body and are usually less harmful, whereas malignant tumors can invade nearby tissues and organs, as well as spread to distant parts of the body through a process called metastasis. Types of cancer. There are over 100 different types of cancer, each classified based on the type of cell or tissue where it originates. Some common types of cancer include 1. Carcinomas. These cancers begin in the skin or tissues that line internal organs, such as the lungs, breasts, prostate, and colon. 2. Sarcomas. These cancers develop in the bones, cartilage, muscles, blood vessels, or other connective tissues. 3. Leukemias. These cancers affect the blood and bone marrow, leading to the abnormal production of white blood cells. 4. Lymphomas. These cancers affect the lymphatic system, which is part of the body's immune system, and can occur in lymph nodes, spleen, or other lymphatic tissues. 5. Central nervous system cancers. These cancers affect the brain and spinal cord, such as gliomas and meningiomas. Understanding the different types of cancer and their underlying mechanisms is crucial for accurate diagnosis, treatment planning, and improving outcomes for patients. Different types of cancer and their characteristics. 6. Carcinoma. Carcinomas originate from epithelial cells, both on the body's internal and external surfaces. Examples include breast cancer, prostate cancer, lung cancer, and colon cancer. Carcinomas often form tumors in organs and can metastasize. 7. Sarcoma. Sarcomas arise from connective tissues such as bone, muscle, cartilage, or blood vessels. Examples include osteosarcoma, bone cancer, rhabdomyosarcoma, muscle cancer, and liposarcoma, fat tissue cancer. 8. Lymphoma. Lymphoma originates from lymphocytes in the lymphatic system. It can affect lymphatic tissues such as lymph nodes, spleen, or other lymphatic organs. Hodgkin lymphoma and non-Hodgkin lymphoma are common types of lymphoma. 9. Leukemia. Leukemia results from abnormal production of blood cells in the bone marrow. These abnormal blood cells often infiltrate the bloodstream and can spread to other parts of the body. Types include acute lymphoblastic leukemia, or, and chronic myeloid leukemia, CML. 10. Malignant melanoma. Melanoma arises from pigment-producing cells called melanocytes in the skin. It typically begins in moles or pigmented areas of the skin and can metastasize. 11. Prostate cancer. Prostate cancer originates from abnormal growth of cells in the prostate gland. It is one of the most common cancers in men and tends to grow slowly. 12. Breast cancer. Breast cancer arises from abnormal growth of cells in the breast tissue. It is one of the most common cancers in women but can also occur in men. Each type of cancer presents different symptoms, risk factors, and treatment options. Early detection and treatment are crucial in the fight against cancer and can significantly improve patient survival and quality of life. Cancer symptoms can vary widely depending on the type and location of the cancer, as well as individual factors such as overall health and stage of the disease. However, some common signs and symptoms of cancer may include 1. Unexplained weight loss. Significant and unexplained weight loss, often accompanied by loss of appetite, can be a symptom of various types of cancer. 2. Fatigue. Persistent and unexplained fatigue, weakness, or lack of energy that doesn't improve with rest can sometimes indicate an underlying cancer. 3. Changes in bowel or bladder habits. Persistent changes in bowel habits, such as diarrhea, constipation, or changes in the size or shape of stools, as well as changes in urinary habits, can be symptoms of colorectal, bladder, or prostate cancer. 4. Persistent cough or hoarseness. A persistent cough, hoarseness, or difficulty swallowing that doesn't go away can be signs of lung, throat, or esophageal cancer. 5. Skin changes, changes in the size, shape, color, or texture of moles or skin lesions, as well as the development of new lumps or sores that don't heal, can be symptoms of skin cancer. 6. Unusual bleeding or discharge. Unexplained bleeding from the rectum, vagina, or any other part of the body, as well as blood in the urine or stool, can be symptoms of various cancers. Similarly, abnormal vaginal bleeding or discharge can be a sign of gynecological cancers. 7. Persistent pain. Persistent pain in any part of the body that doesn't improve with treatment can be a symptom of advanced cancer. 8. Changes in skin or nail. Changes in the skin, such as yellowing, jaundice, darkening, or reddening, as well as changes in the nails, such as clubbing or unusual growth, can sometimes indicate an underlying cancer. It's important to note that these symptoms can also be caused by conditions other than cancer. However, if you experience any persistent or unusual symptoms that concern you, it's essential to consult a healthcare professional for proper evaluation and diagnosis. Early detection and treatment can significantly improve outcomes for cancer patients. How is cancer diagnosed? What are the parameters used in the diagnosis process? The diagnosis of cancer typically involves a series of tests and imaging procedures. These methods are used to evaluate patients with symptoms and confirm the presence of cancer. Here are some commonly used methods in cancer diagnosis. Physical examination. The doctor conducts a physical examination to assess the patient's medical history and symptoms. During the examination, the doctor checks for any abnormalities or masses in the body. Imaging tests. Imaging tests such as X-rays, computed tomography, CT, scans, magnetic resonance imaging, MRI, positron emission tomography, PET, and ultrasound are used to create detailed images of internal organs or tissues. These imaging techniques help determine the size, location, and spread of tumors. Biopsy. Biopsy involves the removal of a tissue sample from a suspicious mass. The sample is then examined under a microscope to determine the presence and type of cancer cells. Biopsy is usually performed surgically, but sometimes it can be done using a fine needle or endoscopically. Blood tests. Certain blood tests can help detect the presence of specific proteins or other substances known as tumor markers. For example, tests like PSA, prostate-specific antigen, for prostate cancer or a complete blood count, CBC, for leukemia may be used. Cytological and histological examination. Cytology and histology involve the examination of cells under a microscope. Cytological examination examines body fluids or cell samples, while histological examination examines tissue samples obtained through biopsy. These methods are often used in combination for the diagnosis of cancer, and the diagnostic process is determined based on the patient's symptoms, medical history, and suspicion of possible cancer presence. Accurate diagnosis is crucial for determining appropriate treatment options and preventing disease progression. What are the treatment options for cancer? Cancer treatment options can vary depending on the type of cancer, stage of progression, overall health condition, and other factors. However, some commonly used treatment options include Surgery. Surgical removal of cancerous tissue is often a primary treatment method for controlling or treating cancer. Surgery can be used to remove tumors, prevent the spread of cancer, or reduce the size of tumors. Chemotherapy. Chemotherapy involves the use of drugs to kill cancer cells or inhibit their growth. It can be used to prevent cancer from spreading to other parts of the body or to shrink existing tumors. However, chemotherapy can also affect healthy cells and lead to side effects. Radiation therapy. Radiation therapy uses high-energy rays to kill cancer cells or stop them from growing. It can be used to control or shrink tumors and is often used in conjunction with other treatments. Radiation therapy can have side effects, which vary depending on the treatment area and the type of cancer being treated. Immunotherapy. Immunotherapy aims to stimulate the body's immune system to recognize and destroy cancer cells. This treatment targets cancer cells while minimizing damage to healthy cells. Hormone therapy. Hormone therapy aims to alter hormone levels or block hormone receptors in hormone-sensitive cancers. It can help control or slow down the growth of cancer cells. Targeted therapies. Targeted therapies involve drugs or other treatment methods designed to target specific features of cancer cells. These treatments aim to effectively destroy or control cancer cells by targeting a specific pathway in cancer cells. Cancer treatment often involves a combination of methods, and individual treatment plans are determined based on the patient's condition and the characteristics of the cancer. Close collaboration between the patient and the doctor is necessary to make informed decisions about treatment options. What are the side effects experienced during cancer treatment and what are the ways to deal with them? The side effects experienced during cancer treatment can vary depending on the treatment method and the individual's condition. However, some commonly encountered side effects may include 1. Fatigue, a common side effect during and after treatment. Rest, regular exercise, and maintaining a proper sleep schedule can help alleviate fatigue. 2. Nausea and vomiting, commonly seen especially after chemotherapy and radiation therapy. These symptoms can be managed with antiemetic medications or dietary changes. 3. Hair loss, common during chemotherapy. Supportive measures such as wearing a wig or headscarf can be helpful. 4. Weakened immune system. Chemotherapy and radiation therapy can weaken the immune system and increase the risk of infection. It's important to adhere to hygiene practices, eat a healthy diet, and receive recommended vaccinations. 5. Skin problems. Radiation therapy or certain medications can cause dryness, redness, irritation, or a burning sensation on the skin. Using moisturizing creams or special skincare products can help alleviate these effects. 6. Diarrhea or constipation. Chemotherapy or other treatments affecting the intestines can cause digestive problems. Healthy eating habits and consuming plenty of fluids can help manage these symptoms. 7. Mucositis. Irritation or sores in the mouth, throat, or gastrointestinal system can occur after chemotherapy or radiation therapy. Special gargle solutions or mouth rinsing methods can help alleviate these symptoms. To cope with these side effects, some general strategies may include: stay in regular communication with your doctor and share any side effects you experience. Pay attention to healthy eating habits and ensure you're getting the nutrients your body needs. Maintain physical activity as much as possible, but avoid overexertion. Get regular rest and maintain a proper sleep schedule. Consider seeking psychological support from a therapist or joining support groups when needed. Explore alternative or complementary therapies, such as acupuncture or yoga, to cope with side effects, but discuss these with your doctor and obtain approval. What are cancer prevention methods and healthy living habits? 1. Not smoking or quitting smoking. Smoking is associated with many types of cancer. Quitting smoking not only reduces the risk of cancer but also has many other positive effects on overall health. 2. Healthy eating. A balanced and varied diet can reduce the risk of cancer. A diet rich in vegetables, fruits, whole grains, protein sources, and healthy fats can help maintain a healthy body weight and reduce the risk of cancer. 3. Physical activity. Regular exercise not only reduces the risk of cancer but also has many other health benefits. It is recommended to engage in at least 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity exercise per week. 4. Maintaining a healthy body weight. Being overweight or obese is associated with many types of cancer. Maintaining a healthy body weight or losing weight can reduce the risk of cancer. 5. Limiting alcohol consumption. Alcohol consumption has been shown to increase the risk of cancer. Limiting alcohol consumption or quitting altogether can reduce the risk of cancer. 6. Sun protection. Overexposure to the sun can increase the risk of skin cancer. Using sunscreen, wearing protective clothing, and avoiding the sun can reduce the risk of skin cancer. 7. Vaccinations. Vaccinations are available for some types of cancer. In particular, the HPV vaccine can be effective in preventing cervical cancer and some other types of cancer. 8. Regular screening and checkups. Early detection can increase the chances of successful treatment for certain types of cancer. Regular screening tests and health checkups can help reduce the risk of cancer and aid in early detection. By adopting these healthy lifestyle habits, it is possible to reduce the risk of cancer. Additionally, regularly consulting with your doctor and monitoring your health is an important part of a preventive approach. In conclusion, cancer prevention is a proactive approach that involves adopting healthy lifestyle habits and making informed choices. By avoiding smoking, maintaining a balanced diet, engaging in regular physical activity, and limiting alcohol consumption, individuals can significantly reduce their risk of developing cancer. Additionally, practicing sun protection, receiving vaccinations where applicable, and undergoing regular screenings and checkups play crucial roles in early detection and prevention. By embracing these preventive measures and fostering a supportive relationship with healthcare professionals, we can take control of our health and work towards a future where cancer incidence is minimized, and lives are enriched with vitality and well-being. Thank you for watching the Mr. Hospital Doctor channel. Don't forget to subscribe to stay informed about more health-related content and like the videos. Keep following us for a journey filled with healthy and informative content.